Hello, and welcome to my podcast, The Chemistry of Life, where we explore the intricate world of health, wellness, and how it relates to chemistry. I'm your host Rudransh, and today we are with Dr. Gaurav Bhalla, a physician who works at Max Clinic. Good evening, Dr. Bhalla. Could you tell us a little bit about yourself?
So good evening, Rudransh. I am Dr. Gaurav Bhalla, consultant physician and diabetologist in Max Group of Hospitals. So I'm working presently with Max Hospital as well as I have my own clinic in New Delhi.
What field of medicine do you specialize in?
So I'm basically a physician that is who specializes in internal medicine. That is I treat patients who are suffering from infections, diabetes, thyroid disorders, cardiac patients. So all these kind of patients who are dealing with routine physician problems, we are dealing with those people.
Since you mentioned diabetes, I've heard that has been a rise of cases of diabetes in the recent years.
Yeah, you're absolutely right. So as we all know that India is the capital of diabetes, and presently every third person in India is having diabetes as of now. So present data shows that we have surpassed China also in the present scenario. So you already know that the sedentary lifestyle as well as obesity, these are the two most common factors which are affecting patients, and it is the leading cause of type 2 diabetes in India. First of all, as we all know that mainly diabetes is of two types, that is type 1 and type 2. So type 1 diabetes is basically more of genetic disorder. In this, the beta cells, they do not produce insulin in the body, as well as there is lack of beta cells in the body. And type 2 diabetes is basically the decreased production and secretion of insulin in the body because of the low number of beta cells. So the most common factor which is leading to diabetes is obesity and sedentary lifestyle. Also, young children probably they are taking more of junk food these days and not eating healthy foods. So these two factors are mainly responsible for the rise of diabetes in India.
Are there any specific preservatives or chemicals in junk food that affect diabetes?
So basically, these people are using saccharin, which is again an additive, and also it is a fattening agent. People are using these kind of products as preservatives in junk food. You can see people around you who are having soft drinks. It has basically no nutritional value. They have only calories. So increased calorie intake leads to increased fat deposition in the body. Again, the fat deposition leads to obesity, which increases the chances of diabetes to be developed in that person.
So, how does insulin break down sugar in the body?
So Rudransh, it's a common misconception that insulin causes breakdown of glucose. It doesn't happen like this. So what insulin does is it pushes the glucose into the liver and also into the peripheral tissue of the body.
Oh, okay.
So in liver there is a process which is known as gluconeogenesis. So the glucose utilization actually happens in the liver, and moreover also as our muscles need glucose to work. So if they don't get adequate amount of glucose, they will obviously go into fatigue. So insulin helps in peripheral utilization of glucose, that is it helps the muscles to absorb the glucose and also decrease the blood glucose levels into the body. So this is the way insulin helps the body to utilize glucose, that is in the liver as well as in peripheral tissue.
Okay. So, you mentioned that it pushes glucose into the liver.
Yeah.
Does this also relate to people suffering from fatty livers?
Yeah, obviously yes. The more obese the person, more there are chances of fatty liver, and obviously more glucose. If more glucose is being pushed into the liver, there is increased gluconeogenesis into the liver, and again the byproduct is going to be fatty. So it's fatty liver. It increases the chances of fatty liver in patients of obesity, and eventually it leads to cirrhosis, which is the last stage of liver failure.